interview series on radio and podcast. The show covering all things health, wellness, culture, and more. The show for all of us who aren't old, we're better. Each week, we'll interview superstars, experts, and ordinary people doing extraordinary things, all related to this wonderful experience of getting better, not just older. Now, here's your host, the award-winning Paul Vogelzang.
Welcome, everyone, to the Prevention Magazine Healthy Living interview series on the Not Old Better Show. I'm Paul Vogelzang. I am so glad you're here with us today. Today's episode is brought to you by Daily Greens by Factor Form. We have got a fantastic returning guest. I always enjoy talking to her. She, of course, is an independent health journalist and author of mindful women's novels, including the award-winning Warrior One, and her new book, Yoga Bind, which will be published next spring. We're going to be talking to her then. We're talking to her today. She's a longtime Prevention Magazine contributor, Meryl Davids Landau, who's bringing us the kind of conversation that sticks with you long after you've stopped listening. Now, quick question. Have you been stressing about hitting 10,000 steps a day? What if I told you that 7,000 is actually the sweet spot and that getting there might just cut your risk of dementia, heart disease, and even depression? And what if I also told you that you don't even need to leave your chair to start feeling better? Yep, that's right. That's what today's episode is all about. Real, simple, science-backed ways to feel healthier right now. We're talking about the surprising new step count research that's changing how we think about fitness. We are going to be talking about easy desk yoga moves that improve flexibility, reduce stress, and help you actually enjoy your time in front of the screen. Yep, that's right. And a whirlwind look at 75 years of life-changing medical innovations from Prevention Magazine, from juice can dialysis machines to gene-edited cures. Prevention Magazine is turning 75, and we're celebrating the breakthroughs that have reshaped what it means to grow older with strength, with dignity, and with joy. Here to guide us through it all is Meryl Davids Landau, who has a gift for taking the science and making it stick. So stand up if you want, stretch if you need to. I'm going to be doing a little bit of that, or just settle in, because this one's going to make you think and maybe even rethink what a healthy lifestyle really looks like. Join us today for our Prevention Magazine Healthy Living interview series with returning guest, audience favorite, Meryl Davids Landau. Meryl Davids Landau, it's so good to see you. Welcome back to the program.
Thank you, Paul. Appreciate it.
Well, I've got several things that I want to talk to you about. It's been a little bit since we've had a chance to catch up, and you're always so busy. You're doing some very neat things. I have to tell you, one of your recent articles, I found it in National Geographic, and by the way, for all of our audience, we're going to have links so that our audience can find out more about Meryl Davids Landau and her wonderful work, including this excellent article that just jumped right out at me, Meryl. I loved it. Forget about 10,000 steps a day. Science now has a more accurate number, by Meryl Davids Landau. It was in National Geographic. Congrats on the article and all of your work. But, for so long, we've been, just taught, I suppose, where, we hear it from everybody, 10,000 steps, 10,000 steps. You got to do 10,000 steps. And now science is saying, well, maybe, but 7,000 might be good too. And there's a lot of reasoning behind that, a lot of science. So give us a little snapshot of what that means, the 7,000 versus the 10,000.
Yeah, the 10,000, if you say we've heard it from a lot of places, but we've really never heard it from medical science, because there was never really any research that looked at, do we need 10,000 steps and is there a benefit to 10,000 steps? That number reportedly came from a Japanese pedometer company back in the day, when they just gave it a name that in Japanese translates to 10,000 steps. And so that just became, we should all do that. But in recent years, there has been more research where because people are wearing the watches now, and you're able to track steps more easily. So scientists have been able to really look at how many steps really make a difference for people. And so a number of studies came out in the last couple of years. And then this study that I was writing about in National Geographic was a review article looking at what has the research in the last few years shown for different kinds of medical conditions. And they really found that 7,000 steps is enough. Not that you can't do 10,000 and not that there's not benefit for some conditions in going over the 7,000, but really the bulk of the benefits come when you hit about 7,000 steps a day. And after that, it's kind of a law of diminishing returns. So that's good news because most of us never got to 10,000 steps a day.
Right.
So instead of feeling bad about doing 7,000, now you can make that your new goal and feel good about it.
Yeah, and I think that is helpful to know because 10,000 was that number that we probably wanted to hit, but whether it's time constraints during our days or whether it's our own physicality and maybe some joint health, fitting that in. How do you see fitting 7,000 steps in now, especially for our 50 plus audience? Give us a couple of hits.
Yeah, I think even 7,000, it can be a tall order for people.
Yeah.
You're not going to get that if you mostly sit at your desk like I do during the day. You're not going to get that just from, unless you make a concerted effort to really try to walk. And so I think that that's where, we all kind of need to make walking more of a priority. Because as I said, the research that I wrote about in National Geographic talks about how just if you can hit those 7,000 steps, it's good for cardiovascular disease, good for brain health, type 2 diabetes, it prevents falls, all-cause deaths from any cause. All of that was really assisted when people walk 7,000 steps. So I think we all need to remember that and make walking a little more of a priority in our life than we do. But that it doesn't have to be I'm going out on a 2-hour walk and getting all of my steps in. It's really about just breaking it up and walking when you can. So my husband started just walking around his office building. He just, in the middle of the day when he has a lull, he'll get up and he'll just walk around, do a couple of laps around the place. I always try to park in the first spot the minute I get into a parking lot, no matter what store I'm going to, no matter how big the shopping plaza is. The first, as soon as I get in, that's where I try to park. And really, you get to avoid the traffic that way too, because everybody's hovering around where these popular stores are, right? And then you're walking, so you're adding 500 steps here, 500 steps there. If you go into the supermarket, maybe give a loop around the perimeter of the supermarket before you start your shopping. I mean, just thinking about walking and how can I just add a few steps here and there is really helpful. And then for people who do have health issues or who worry about it, there's a great organization called Walk with a Doc that where in a number of communities, physicians or other medical staff organize walks, like weekly walks with people. So people can walk together with other people. They can ask the doctor questions or address concerns that they have about it. And so you can look up on the website. It's a nonprofit organization, Walk with a Doc. And you can see if there's one in your neighborhood. That could be a good way to really get started walking more.
Yeah, well, thank you for that. Because there are some tricks, certainly, but there's some real benefits to this. It's not just a kind of an elusive thing. You mentioned dementia and certainly heart disease, even getting a better sense of balance and avoiding falls. What is it that the doctors are saying about walking that just makes it such a wonderful prescription for good health for those of us that are, in our later years?
Yeah, I mean, it turns out, we used to say an apple a day keeps the doctor away, right? But really, it should be walking every day keeps the doctor away. Because walking is so beneficial to so many aspects of our body. And I think doctors don't even really know all of them yet. They're still kind of parsing out exactly what walking does physically to us. But certainly we know it increases the flow of oxygen, which means more oxygen is coming to all the cells of your body, which do everything, right? So the more every cell in our body is functioning better, the better, healthier we're going to be. And it also is helping nutrients through our blood get to more of the places where they need to go. Walking has, long been known to control risk factors that are bad for our health, like hypertension and other diabetes are helped by exercise, but walking is, a sufficient exercise in that regard. Even the gut, which I think scientists are still trying to learn as much as they can about, but the motility, the movement of things in our gut and the composition of what the bacteria and other factors in our microbiome are really, it's really becoming clear that that's so important for health in the gut and outside of the gut. And the gut walking is a major factor in how well your gut works. You need to be moving in order for the motion in the gut to keep going. So I think all of those things, whether one or two are more important than the others, I think is still being parsed out, and whether, there are other factors that we don't even know yet. But it's clear that just, a good amount of walking every day is just so beneficial for so many parts of your body and your brain.
We will be right back with independent health journalist and author of mindful women's novels, including the award-winning Warrior One and her new book coming out in the spring, Yoga Bind. We're talking with Meryl Davids Landau. And if that desk yoga hasn't made you want to roll your shoulders yet, I hope it's at least reminded you to blink. Yep. Coming up, we're taking a trip through time. Meryl Davids Landau walks us through some of the greatest health breakthroughs and innovations of the last 75 years, celebrating Prevention Magazine's 75th anniversary, from reattached limbs to wearable heart monitors and gene editing. You'll be amazed by where we've been and inspired by what's next. Stay with us after this. I talk about this all the time. You all know I'm a healthy guy, believing in supplements and trying always to get my balance of green vegetables. Years ago, I tried one of those greens powders, one that you mix with water or other liquids. One sip, and it was like drinking a glass of lawn clippings. I'm serious. I said never again. But then I heard about Daily Greens by Factor Form. And since I already trust Factor Meals, I gave it a shot. Factor Form is a sister brand to Factor Meals, so they know flavor. These aren't just supplements. They're part of a healthy lifestyle designed to make good nutrition easy and enjoyable. I love Factor Meals. We love them here. And now Daily Greens is part of my routine too. I was floored. It's smooth, citrusy, clean, not grassy or chalky, and I actually look forward to drinking it every day. Just mix one scoop or a single serve pack with water, and you're done. Daily Greens delivers 100% of your daily nutrients. It's made from real veggies like kale and spinach, but doesn't taste like it. No added sugar, no weird fillers, just whole food ingredients that work. Plus, it's packed with prebiotics, probiotics, and adaptogens to support digestion and reduce bloating. For GLP-1 users, and I know you're out there and listening, this is big. It fills those gaps in fiber and nutrients, supports gentle digestion, and helps with regularity. It's easy on your stomach and easy to stick with. No wonder most people keep taking it week after week. So, what are you afraid of? Another glass of grass? This one's different. Try it. You'll like it. Start your day right with Daily Greens by Factor Form at factor75.com/NOB to get 40% off plus free shipping on your first order. All of this will be in our show notes today, but again, that's factor75.com/NOB for 40% off plus free shipping. Again, visit factor75.com/NOB. Thanks, everybody. Meryl Davids Landau is our guest, written this fantastic article in National Geographic. Forget about 10,000 steps a day. Science now has a more accurate number. I enjoyed the article. I want to encourage our audience to check it out. Again, we'll have links so that our audience can find that article as well as all of your other great work. Meryl Davids Landau, of course, you are an independent health journalist, author of mindful women's novels, including the award-winning Warrior One, which you and I have talked about in the past. Are you in the process of writing now a new book titled Yoga Bind, which will be published next spring? I want to have you back and talk about that too. But I found an article that's upcoming by you, and we'll put some links so that our audience can find it specifically too. From Prevention Magazine. You and I first met via Prevention Magazine. So I want to talk to you about a couple of articles that are Prevention Magazine related and also have to do with movement. The one that just jumped out at me, I thought was so fascinating because I'm a desk-bound person for much of my day.
As am I. Yes.
Yeah, the great title to this article too, De-deskify your body, simple yoga at your desk. So tell us a little bit about that. and why you don't necessarily have to roll out a mat each day to get the benefits of yoga. You can do that at your desk.
Yes, and as you can tell from my novels, which are all about yoga as one
Yeah.
of the ways that people can be more mindful and calm during the day. I love yoga. I do a lot of yoga practicing. But when I was introduced to this particular method, which the editor of Prevention magazine went to Thailand actually and experienced this yoga, I was really struck by how it was very small movements, whereas yoga is usually grand, sweeping. We're doing warrior one and warrior two, and we're moving the body in a big way. You're using your small muscles. You're using your hands, your fingers. You're using your shoulders, your eyes, even. And I thought, this is so perfect to just do at your desk, right? I mean, you don't have to get up. You don't have to sit on the floor. You don't have to roll out a yoga mat. And so I started doing some of these poses after I wrote this article. I started doing some of them at my desk, and it's really great to just stretch out some of these body parts that really get cramped up when you're sitting at your desk. So the article just talks about small types of practices
Yeah.
that you can
Yeah.
do.
One that jumped out, I mean, I saw the mention of, from kind of eyes to spine. And I thought that's really interesting because we don't really hear much about yoga for the eyes necessarily. I mean, there's the power of breathing that goes along with this, but what gives us maximum impact as we're seated at our desk each day from these yoga moves?
I mean, personally, just because I sit at my desk typing a lot during the day, I think it's the hands and the wrists and the fingers. One of the exercises that I really love that I've been doing a lot at my desk after I wrote this article is about finger pulls, really, because, we spend a lot of our time, our hand is clutched on the mouse like this.
Yeah.
Our hands are typing like this, very, claw kind of positions. And so if you just stretch your arm out and start, pull your finger back
Uh-huh.
and wiggle it around a little bit, and then you can, do that with each of your fingers. You're just
Uh-huh.
pulling it around like this. Um, it really pulls the fingers in the opposite direction and pulls the wrists in the opposite direction from the way we spend most of our time kind of fixed like that. And when you finish, your hands will feel really quite amazing. And you talked about the eyes. I really do like the eye movements as
Yeah.
well.
Yeah.
And you can just like imagine the face of a clock and keep your head steady. Just look up to 12 and then kind of roll your eyes gently around to 1, 2, 3, all the way around. And then, we could do a couple in that direction, a couple in the other direction. And
Hmm.
it really stretches out the muscles of your eyes. And again, if you're sitting at your desk, your eyes are fixed at the direction of the distance to your computer or the distance to the paper in front of you. And you really just, if you're stretching them out by doing eye exercises, it really just helps bring a lot of blood to the area and makes them feel really good.
It's really worth pointing out that you can do this in 60 seconds. You can do this in 30 seconds. This is the kind of thing that really you can put into practice and have some results pretty quickly.
Yes, and you can just choose. You can just do one of the exercises. Like I said, just in that, but just as I'm demonstrating here, my fingers are feeling
Yeah.
better,
Yeah.
right? I
Yeah.
mean,
Yeah.
you can just pick one or two small exercises and just do it whenever the mood strikes you, and I think you can get a lot of benefit from that.
Well, good. Well, let's move on to a an article that is upcoming, perhaps near and dear to both of us. Prevention Magazine. I've always been a fan, and I enjoy the print edition. But Prevention Magazine turns 75 this year. What a history! And it's been a healthcare reference tool and now fitness and mindfulness, all kinds of things wrapped up into one. And you've reviewed decades of these groundbreaking, medical advancements in an article titled "Amazing Health Innovations: 75 Years of." And I want to touch on that and give you a chance to talk a little bit about that because I think there's so many great things. Which ones really jumped out at you as being some of the most powerful over that time?
I mean, there really are a lot of amazing, great
Yeah.
innovations when you really stop and assess them, right? But the first one that I listed in the article, because we went back the 75 years of prevention's age, so starting with 1950, when
Wow.
prevention first came out, what were the innovations that started then? And kidney dialysis was really one of them that just struck me that it goes back that far because that was when the first dialysis program was initiated in the United States. It was invented a couple of years earlier, but that was when people were first able to access kidney dialysis in the US. And when you think about how many lives that has saved, I mean, the kidneys are crucial to filtering out all the toxins in a person. So without that, um, you know, many, many people would not have survived. But I love that the first artificial kidney that they were testing it on was made of like juice cans and sausage casings and pieces of a washing machine. It really shows how innovative people are. Like, let's just take these things out there and see if we can make it work. And I thought that was really one of the fascinating um, innovations. And then, of course, IVF or test tube babies.
Yeah.
We have more than 12 million people in the world now who come from that technology, or people who never previously would have been able to have a child now can. And I have to, of course, say vaccines, even though I know they've become controversial in this day and age. But when you think about, smallpox or polio, this is not something we ever really have to think about anymore. And those were killing millions of people before the vaccines came out. So I think that those are, to me, some of the most gee whiz kind of innovations when you stop and look back at 75-year history.
Yeah, as I was looking through the article too, I just thought it's absolutely gee whiz. Some of them is even sci-fi related. Robotic surgery, is just so advanced today.
Yes.
Which one of the innovations did you feel like has the biggest impact on the daily lives of older adults? Was there one that just you thought that's where we need to be?
I think probably the cancer treatments, the immune system drugs, like the checkpoint inhibitors and other drugs that, because, one of the biggest problems with cancer is how sneaky cancer is, right? How it's able to evade the immune system, because normally our body produces, errant cells, and then the immune system attacks them and they're wiped out. And then we just go on with our day. But it's when the cells are able to proliferate because the immune system, for some reason, is not able to detect the cancer, that's when it grows and really becomes a problem. So, the inventions in more recent years where they've figured out how can we help the immune system find these tumors and attack them, um, even though the cancer cells are being so wily and doing everything they can to evade them. To me, that's probably one of the most, sci-fi and gee whiz kind of innovations. Um, but of course, gene editing, right? I mean, the ability to take our DNA and splice it up and take out problematic parts of the genes, that's really just coming to the fore now. And in terms of its usage, I think we're going to be seeing a lot of interesting changes in that regard as well.
We're certainly seeing an awful lot of interesting changes when it comes to women's health, and that's almost
Yes.
yeah, and
What was
so
women's health 75 years ago? That wasn't even a thing, right? People
not
wouldn't
even a
even
thing.
talked about women's health.
Yeah,
It was all hush hush, and we don't mention all the things that might impact women.
and
Yes.
now postmenopausal women are getting there's a lot of attention around this subject. You must have felt a big well of pride as you were looking through some of this, that we have come a long way, and some of this progress comes as a result of your reporting on it and people paying more attention. And I think that this is what science needs to do. We need to embrace some of these, parts of submedicine that really deserve this attention. What is it that you're seeing in women's health that has really made leaps and bounds improvements for daily lives?
And I do have to credit the women's magazines in some regards, because they were the ones writing about these things and talking about these things, well before any other mainstream publication would touch them. But, one of the things that kind of surprised me when I was doing the research for this article on the 75 years of innovations was it wasn't until 1993 that women were included in clinical trials. Before that, they would just say, well, if it works in men, it works for women. And even the lab animals were male. They didn't even use female lab animals when they were testing things. And of course, we know, no, if it works in men, women are not men; they're different. So, I think the inclusion of women in clinical trials, just kind of more broadly, has been a huge innovation for health in general, women's health in particular. And I also, think the Pap smear, right? That's another example of a person just pushing. This Greek immigrant physician thought, if we microscopically examine cervical cells, I think we can find cancers. And he was laughed out of the room. I mean, most of the doctors said, first of all, we don't focus on women's health. And second of all, no, we don't think that this is going to work. And it was only because he persisted that we have the Pap smear that we have today. That's not particularly for older women, it's for all women. But, cervical cancer mortality has been slashed so dramatically because of that test. And then, of course, as you mentioned, menopause, right? That would be, nobody could even mention the word menopause. Even until a few years ago, it was still considered kind of hush-hush and people didn't talk about it. And now there are drugs, hormonal drugs and non-hormonal drugs that can really help women who are having issues with hot flashes and other symptoms of menopause. So I think that there has been a lot more focus, but there needs to be still much more focus than there even is currently.
Is there a health invention over that time that just, still blows your mind as you kind of think about its, kind of progress and where it is today?
I think all of the things that we talked about in this article are kind of amazing innovations, most of which are still around today, right? I mean, artificial hands and just drugs that fight AIDS, that fight so many other types of conditions. These are things that when they first came out, I'm sure people thought they were crazy, and then here they are, just a part of everyday life. Artificial hearts, pacemakers, right? I mean, so many things that we take for granted today. If you have a heart issue, you go to the doctor. If you need a pacemaker, you get a pacemaker. But think about before that, like somebody came up with that idea, right?
It's always so great to talk to you. I know you're so busy and we so appreciate your time. I just have one really kind of final question. Wrap it up for us and maybe let's look forward. What do you think the big major health innovation is going to be for aging Americans, coming up? Make a prediction for us.
Well, I'm actually working on a piece now for a spring prevention issue looking at the longevity space. And I think that that's really going to see a lot of improvements. There are so many drugs that are in clinical trials right now that really look at the core of our cells. How can we keep our cells from aging as much as they are? How do we keep tissue from aging? How do we replace tissue that's been damaged from aging or from injury or other things? And I think there's just been, it's all right now, it's still all in the testing phase. So I think when people say, I found this drug or I take this medicine, I don't recommend that. I know that's very big on social media right now to biohack your longevity. I think a lot of that, you should really still just eat your fruits and vegetables and make sure you exercise every day. But I think it's coming, as the research is really gonna start to bear out which of these drugs and which of these procedures really can, get our stem cells to revitalize lung tissue or heart tissue or other tissue. And that's going to be amazing when it happens, but we're not there yet.
All right. Well, Meryl Davids Landau, it's always a pleasure to talk with you. We're going to have a few rapid fire questions for you. I know our audience is going to enjoy this. So, you can have one word answers, you can have full sentences, however you'd like to treat this. But I've put together a couple questions that I thought might lend themselves to just this kind of question and answer with you. So maybe tell us, what's the first thing you stretch when you sit down at your desk?
I stretch my wrists. I clasp my fingers, I turn my palms out, and I push. And I think that that's a really good way to kind of get the kinks out of the wrist before we start on the keyboard.
What's the biggest myth that is out there about walking and health that you would wish could just go away?
Well, I think the myth is that we need 10,000 steps a day to benefit our health, because the new research is showing 7,000 is a good number to aim for.
How about the most underrated medical innovation of the past 75 years?
I think it's kidney dialysis. Nobody even thinks about that unless they need it anymore. But that's really saving so many lives. And of course, controversially today, unfortunately, vaccines.
I wear a smartwatch. I know you do. I see it there. I wonder if you'd tell us, step tracker or smartwatch, which do you prefer?
I'm an Apple girl all the way. So this is an Apple Watch, and it links to my phone and computer and all the Apple devices.
What's more powerful? A good walk, a good laugh, a good book, or a good nap?
Oh, I think all of those are really good to do. But I would say laugh, because I do think that we underestimate the dangers of stress to our health. And the more we can have fun and just enjoy things, the healthier we're going to be.
So last one, what health advice would you have given your previous age self, whether that's 40 or 30? What would you say just in a few words?
I would say don't sweat it, which is something that my dad never did. And he's 95 years old and going strong. So I do think that there's a real benefit to chilling out and not letting things wind you up.
So great. Thank you so much, Meryl Davids Landau. You just break it down so well for us. And as I say, I always enjoy talking to you. So we really appreciate it.
Thank you, Paul.
Thanks again to Meryl Davids Landau for joining us, and to Prevention Magazine for sharing stories and science that help all of us lead fuller, healthier lives. Prevention Magazine Healthy Living series on the Not Old Better Show, brought to you today by Daily Greens by Factor Form. If you enjoyed today's conversation, and I hope you did, there's a whole catalog of inspiring, practical interviews waiting for you, all under the Prevention Magazine series headline banner. You can find us at notold-better.com. You can also follow us on social media on Twitter. We're at Not Old Better, and on Instagram, we're simply Not Old Better. This episode, like all of ours, is a production of NOBS Studios. I'm Paul Vogelsang. Please be well. Let's talk about better. The Not Old Better Show, Prevention Magazine Healthy Living series on radio and podcast. Thanks, everybody. We will see you next time.